everybody, my name is Scott Gregory. Today we're going to be performing a head to midline health assessment on my volunteer John.
Hi John, how are you doing?
Good.
Your name is John, right?
Yes.
You know what you're here for today, John?
Yes. Health assessment.
Alrighty, we're going to be doing a head to basically midline health assessment from your head to your midline. So I'm just going to go ahead and start. How have you been feeling lately?
Good.
I'm first going to start by looking at his scalp and his head and feeling the structures of it. Warm to the touch, not overly warm. No palpable sutures that are open. No recent head trauma or anything like that, right?
No.
Okay. So we're going to keep on moving down. Hairline is normal recession for age. Going to be moving on down to the ears. No lesions. Anything like that noted on the outside of the pinna. No lesions noted within. If I had an otoscope, and I don't have an otoscope, if I had one, I'd pull up on the pinna and examine the canal, looking for any drainage, redness, obstruction. I would note the condition of the tympanic membrane, hopefully seeing a pearly gray appearance of the tympanic membrane. Moving on over to his eyes. Would you look at me, please? Pupils are equal round reactive to light. And can you go ahead and stare up at something over my left shoulder? And accommodating as well. Okay. Can you go ahead and lift your head up and look kind of over my head and look at your nares? Looking at his nose, the inferior terminates. Bar, clearly visible. No redness or anything like that noted. If I had, again, an appropriate otoscope, I would also be able to look back further, see if there's any redness or anything like that in the sinus. I'm just going to feel over the sinuses here. Does this cause you any pain or discomfort when I do that?
No.
No extra drainage or anything like that lately?
No.
Okay. Can you go ahead and open up your mouth? Looking in, I don't see any obvious dental caries or anything like that. I don't see any lesions, don't see any redness. Can you say "ah" for me? You can go ahead and stop, thank you. You give those normal appearing, no abnormalities seen in the mouth. Moving on down to the neck. Can you move your neck toward me, just to your right? Just tip your head to your right, to your left, forward, and backward. Does that cause any pain?
No.
If you apply pressure to my hand to your left, does that cause any discomfort?
No.
Strong. And your right. Strong. Okay. Strong and symmetrical. So far, everything throughout the head and the face has been symmetrical and even. So moving on down to palpation of the neck, noting the skin, no abnormality of color on the neck, no problems associated with the neck. So we're going to go ahead and move on down to listening to his lung sounds and testing for any vocal phragmitis. So when I move this, just take a breath in and out before I move to the next place. Breath in and out. Lung fields are clear bilaterally. Bronchovesicular sounds in the mid, which is normal, with a normal vesicular sound on the outside. And like I said again, lungs are clear. So we're going to go ahead and test for vocal phragmitis at this time. We're going to go ahead and have him say "blue moon."
Blue moon. Blue moon.
Yep, every time I move it.
Blue moon. Blue moon.
Alrighty. Because he has a deep voice, some vocal phragmitis is normal. It is able to be palpated in every location, but again, because he has a deep voice, that's a normal finding, not an abnormal finding. We're going to move on to assessing his heart valves. We're going to assess his aortic, pulmonic, tricuspid, and mitral. We're going to be assessing the second intercostal space right sternal border, the second intercostal space left sternal border, the fifth intercostal space left sternal border, and the fifth intercostal space mid-clavicular line. So I'm going to go ahead and have him hold his breath and we'll listen to his heart tones. S1 and S2 are audible in all locations. Note S3, 4, or 5 noted as well. So far, his exam has been normal. John, thank you very much for your help.
Absolutely.
All right, bye.